There you go. Hopefully, is that full screen for you?
Yes, it is. Perfect.
Yeah,
Thank you, Sam.
perfect. Okay, great. Yeah, thank you, everybody. And thank you to the speakers who have gone before me this morning. Got a whole notebook full of notes and things saying, oh, that really aligns with what I'm going to be saying, or I've got something that really supports that. So there's a few things that I'm going to mention that tie into talks that have gone before me today. So as Sanjay said, I'm Sam Belfrage. I'm a third year PhD student at the University of Winchester. And my project is around understanding parental health literacy. And my work has been carried out in Portsmouth and in Southampton. Oh, I'm having the same issue now of moving my slides on. Here we go. Okay, so just so that we're all on the same page to what does health literacy mean? And I've got a definition here from the WHO, from the World Health Organization, which is talking about the personal characteristics, so us as individuals. And I also like to mention that I'm a parent myself as well, and I know it got mentioned in a few talks earlier that I'm having to navigate this the same as lots of other parents. I live in Portsmouth as well, so I've got a real understanding of some of these issues the parents are facing. So this definition of health literacy around the personal characteristics and social resources needed for individuals and communities to access health information, to understand it, to appraise it, to critique it, and then to put that knowledge and understanding into practice. So that's what health literacy is. We have it from that individual level. So for me as a parent myself, for the parents and carers we're working with, but also we have it from an organizational point of view as well. And actually, as the organizations that we work for, what can we be doing to make sure that the health information that we're giving, the signposting, the way that families can navigate services is really, really accessible to the people that we're working with. So we've got the one side of us as individuals, but we've also got the side of the organization as well. So I want to keep both sides in mind. Okay, so a really quick overview of the whole PhD, and I'm really, really open to questions on this later, like away from the call today. So my email address is on the start of the slides, and it's again at the end if anyone wants to talk about any of the other research that I've been doing. So the first piece that I did was a systematic review, which has been published, and it's looking at how effective community-based health literacy interventions are for parents, which led me to this question around actually, well, how are we measuring health literacy? What exactly are we capturing? Which led on to my second study, which is about validity testing of a specific tool to measure health literacy. So I've used something called the Health Literacy Questionnaire. It's been amended to be used for parents, and I'm going to talk about the domains of health literacy that it measures. Then the third study, which I carried out, was around profiling health literacy. So what are the kind of strengths and limitations of parents in Southampton and Portsmouth around their health literacy? And my work has focused on preschool children, so children aged 0 to 4 years. And then the fourth study was around creating a space for stakeholders to come together. So parents themselves alongside frontline practitioners, people working in family hubs, charities and not-for-profit organisations, including Home Start, and coming together to think of health visitors as well, thinking about, okay, how can we address some of these health literacy issues and challenges that we've highlighted from the profiling study? And throughout my research, I've been engaged with patient and public involvement. And I was really fortunate that I managed to recruit somebody who is a parent herself, but she also volunteers with Home Start Portsmouth, so has a real insight into kind of what parents and carers are going through navigating the health services in Portsmouth at this time. Then obviously the final part of any research is around this dissemination and sharing of the findings. Okay, so I'm not going to talk too much about this slide because lots and lots of people who have spoken today have spoken about why is health literacy important, or why is it important that people get the health information in a way that they can access it and understand it and apply it. So these are just some statistics from the Patient Information Forum, but I just wanted to talk very briefly about something that happened to me today. So some post came earlier this morning. I went down to grab it on our break, and I had 2 letters addressed to the parents carers of my daughter Betsy. So I opened them both, and they were both for the same appointment at the hospital, but with different dates, same times, but different dates, different days, different dates. And I had these two letters, and one of them was the time that I had been told. I'd had a text message to say that the appointment was this time. Then the second letter had brought the date forward. So I was like, oh, brilliant. They've moved her appointment forward by a month. This is excellent. Message my husband. And then I was like, do you know what? I should probably just check that that this is the most up-to-date letter. Like, I don't know which order they sent it, because the date at the top of both letters was dated the same, the 13th of September. So I called up the hospital, the outpatients, they're like, no, it's the later date. But that's just an example of, we're all challenged with this information that we're given. This navigating the health system is complex, and little things happen to us. My husband had an appointment at St Mary's Hospital in Portsmouth. In his head, he thought it meant St Mary's in Southampton. He was leaving really, really early. And I was like, why are you going so early? And he was like, oh, I've got to go to Southampton. And I was like, you don't. So, you know, it's just, it affects all of us. So I feel we're really responsible for thinking, okay, what can we do to mitigate these issues that people are facing every day? We have so many other conflicting challenges, especially for people living in areas of high deprivation or low incomes, issues such as housing, you know, income, domestic violence, some of the issues we've spoken about earlier. Actually, navigating these health systems can all feel a little bit too much sometimes. So we know why it matters, and we all take a responsibility to helping to shape that. And another really interesting point that I'd never thought about until I started studying this concept of health literacy is how it changes across your life course. And becoming a parent is a really, really important time in that life course, where you're given a lot of new information, a lot of new services that you need to navigate. And also then, as your child gets older, maybe they experience hospital care, maybe you experience a new long-term diagnosis, your child is diagnosed with a long-term condition. All of these things affect your health literacy, because I have asthma, so my health literacy around managing my asthma might be really good, but it doesn't mean that I've got the skills or the knowledge yet to navigate the services that my daughter needs right now as a 7-year-old. I've got a lot of learning to do, and I've got a lot of questions to ask. So it's just being aware of that. Actually, every time there's something new, a new diagnosis or a new situation or a new service that somebody is accessing, that's really challenging their health literacy. And it's going to take a bit of time for them to feel confident to be able to navigate that, especially if there's any other challenges and disabilities and things running alongside that too. So just to be aware that health literacy is a constantly evolving concept, and it's changing throughout the life course. Okay, so I'm aware that I don't have much time on you guys. I want to get to the good bits that I want to share with you. So how is health literacy measured? There's lots and lots of different ways. We could use a subjective measure, an objective measure. The tool that I've decided to use is something that the World Health Organization promote when thinking about co-design and co-developed interventions. So I'm really, really big on that concept for all the reasons we've spoken about earlier about the importance of co-design and co-development. So the 9 areas of health literacy the questionnaire I use covered are: feeling understood and supported by healthcare providers, having sufficient information to manage my child's health, actively managing my child's health, social support for health, and appraisal of health information. Those 5 domains, or those 5 areas, are measured on a 1 to 4 scale. Then the second half of the questionnaire, which are domains 6 to 9, so there's multiple questions under each domain of the questionnaire. Part 6 is around actively engaging with healthcare providers, navigating the healthcare system, ability to find good health information, and understanding health information well enough to know what to do. Okay, and I'm going to show you some of the findings from my work in Portsmouth and Southampton. So the reason there's the dotted line in the middle of the graph is just to highlight that the scales are different. So obviously the second half of the questionnaire looks like parents have scored much higher, but actually it's just a different scoring system. So I'll tell you a little bit about the findings. So between the 2 cities, they're actually very similar profiles of health literacy. The areas that parents score better in, or the areas that parents score lower in, except for domain 2, where the parents in Southampton scored 12% lower than in Portsmouth. And that was around having sufficient information to manage their child's health. Both cities reported to feeling understood and supported by healthcare providers when they got to see them. So the work that I've carried out has been mixed methods. So there's been quantitative, where there's been surveys, then there's qualitative interviews and focus groups as well. So when I've been able to dive a bit deeper into that, is that parents reported that they felt understood when they'd been able to get those appointments, but actually knowing where to go, knowing how to navigate the system was some of the things that they found much more challenging. Domain 2 was the lowest scoring domain for parents in Southampton, and in Portsmouth, the lowest scoring domain was around social support for health. And we'll talk about some of the recommendations that came forward. So how I further analysed this data, the quantitative data, was through cluster analysis. And it brings together similar profiles. So it groups together parents who have responded in a similar way so that I can look at their profiles. In Southampton, we had over 100 respondents. I think it was around 104. And in Portsmouth, we were aiming for 100 and got around, I think it was 74 responses. Just so you know the sample pool for looking at that. So when those clusters come together of that quantitative data for both cities, in Portsmouth and Southampton, we had 4 distinct clusters. So one cluster were the parents with the highest levels of health literacy. Then we had 2 groups in the middle, and then we had a group with this lowest level of health literacy. And I'm going to speak about those just because I don't have time to go into detail on all of the different profiles. So this is classed as cluster 4 in Portsmouth. These are the parents and carers with the lowest scoring health literacy from using the health literacy questionnaire for parents. And interestingly, no one in this cluster, you can see it's highlighted in bold here, no one in this cluster had reported using A&E in the last 12 months for themselves or for their child. And their lowest scoring domain was having sufficient information to manage their child's health. So interestingly, what we've done with this quantitative data, we've got these profiles, and then to make them into something really meaningful and useful, we've transformed them into vignettes, which is a case study that uses the quantitative data and the qualitative data together to create an example of what somebody in this cluster would look like and some of the challenges that they would be experiencing. So I'm just going to give you the Portsmouth example really quickly and talk about some of the recommendations that came out for it. So this person talks about how that they're new to the area, that they don't have social support. They wish that they could talk to their mum, but she has her own challenges. She has her own mental health conditions. She's not really available for her to support her. She's started talking to a couple of mums, but she doesn't know them well enough yet to ask them to help or ask them any questions. She hasn't registered with a GP yet. She's new to the area and she's just struggling. She doesn't really know what to do. She'd also like to work. She's got a degree, but she hasn't been able to look for a job because it's all just a bit much for her at the moment. So we discussed all of these case studies, so 4 different ones in Portsmouth at a stakeholder event, which was there with parents and frontline professionals, like I mentioned earlier, and volunteers to talk about some solutions. So I'm just going to very quickly highlight some of those solutions and ideas that were brought for the Portsmouth families. So one of them was around being able to access health providers, health professionals when the parents wanted them. And one of the things that they felt quite strongly about was reinstating the drop-in health visitor clinics, which had become book-in only since COVID. And it was highlighted about if somebody was new to the city, that actually having a drop-in clinic would be much more accessible. If somebody was really struggling to manage their time, book appointments, keep appointments, that actually just having that option to drop in, sit and wait, it gives you time to meet other parents, to speak to other parents. Actually, there was a lot of benefits that the parents and other professionals thought about bringing the drop-in health visitor clinics back. Also spoke about education on navigating the healthcare system, which I thought tied in really nicely with the idea of the Healthier Together champions. Also about where health information is coming from. Someone else mentioned earlier around TikTok, and that was another thing that the parents and carers had mentioned, that they were accessing health information from TikTok. What can we do to be quality assuring that, or what can we be doing to signposting parents from TikTok to other resources? So I'm just going to put it onto my final slide just to say key points are health literacy is about how we access, understand, appraise and use health information. An individual's health literacy changes across the life course, and being a new parent is a really key phase to this. Parents suggested the health visitor drop-in clinics and more stay-in-play sessions to help meet their needs of social support for health. And parents and carers want clear, simple instructions on how to self-refer and more information on how to navigate their local health and care services. So even if you think all the information is out there, is it getting to the right people, and can they actually follow it to navigate that? My email address is just on the bottom there. Yeah, please pop any questions in the chat or drop me an email directly, and I would love to talk further about it. Thank you.